She saved us time, not just saving lives every day. Thank you, Kim, and all of you for the privilege of this opportunity to be here today. Greg, thank you for bringing all of us together and making the vaccine available to those desperate need here in Southern California. Today, 4 different locations in the state received vaccines. This was one of the critical sites. Over 17,000 vaccines are down in that ultra-cold refrigerator just downstairs here in the basement. In Southern California and down in San Diego, we had vaccines delivered, and of course up in Northern California at San Francisco General Hospital and St. Joseph Hospital, all the way up in Eureka. That's 4 sites today. Tomorrow, 24 additional sites will receive the vaccine, an additional 5 sites on Wednesday. You'll get a sense of the cadence as these vaccine numbers grow, as more and more vaccines are delivered. 33,150 doses were received today here in the state of California, part of the commitment from Pfizer to provide the state of California 327,600 doses. We are hopeful and enthusiastic about the prospect of Moderna following up after Pfizer with an additional 672,600 doses, potentially within a week or so. We are working for planning purposes so people get a sense of what the state is working, again, from a planning perspective, at looking at anywhere from 2.1 to 2.16 million doses by the end of the calendar year. Now, I want to put that in perspective. We have roughly 2.5 million, 2.4 million healthcare workers. Today, we had 5 of our healthcare workers at least get the first shot of immunization, the first dose. In 21 days, they will be getting a subsequent dose. Let's put this moment in perspective. It is a day where we can lay claim to the fresh air of progress versus that stale air of normalcy. But nonetheless, as was stated, we have to be sober and mindful about the moment we are in, which is challenging and trying. Today, we received as many doses in the entire state of California as there were new cases in the state of California. Over 33,000 new cases recorded today, averaging 31,000 new cases in this state in the last 7 days. 159 people on average have lost their lives every single day in this state in the last week. We've seen a positivity rate in this state go from 3.5% 6 weeks ago to over 10.6% today, close to tripling just in 6 weeks. It is foundational at this moment of optimism and hope that we're also mindful of this moment in the context of our individual effort to do what we can to advance the non-pharmaceutical interventions that have been so impactful in this fight against the pandemic. It is so important that we continue to be vigilant, that we socially distance, physically distance, that we maintain our vigilance as it relates to wearing face coverings, wearing masks, and do everything in our power to mitigate not just the spread and the transmission of this virus, but to mitigate the impact in emergency departments and ICUs all across this state. You may have seen over this weekend, one part of our state, San Joaquin County, ran out of ICU beds. They are officially in surge capacity. We are very close within the next week or so, anticipating that to be replicated in other parts of this state. We are in the midst of the worst moment of this pandemic. So today is hopeful, and it's reason to be optimistic, but let's be mindful of where we really are in terms of this pandemic. And forgive me for saying that, but I am very, very cautious about the moment we're in. Very, very mindful about the pressure Kim and her colleagues are under, not just today, but what they'll be under in a week or 2. And so this is an extraordinary day because we now are protecting those that have been protecting us. We are providing support finally for people like Kim. And Kim made the point, not only for herself, but allowing her to go home and not worry about her family like she was worried about before, not worrying about the stress and pressure she's placing on her loved ones each and every day. And so this is a big day in that respect, and it's a day to celebrate. But again, it's a day to be mindful about the challenge we face. I want to just briefly say a quick couple things on the issue of safety and efficacy. California was one of the first states to create a safety advisory committee. We had 11 members, world-class members. They reviewed phase 1, phase 2 trials. They reviewed all the information concurrently with what was going on FDA and elsewhere, and they signed off on the safety and veracity of this vaccine unanimously. 3 members of our statewide scientific advisory group are also advising the CDC and the FDA and part of the national groups. We were joined by the governors of Nevada, Washington State, and Oregon in that safety review. They have independently reviewed the veracity of all the claims and unanimously have signed off on the efficacy and safety of this vaccine. We followed that up with a guidelines task force that's looking at equity. Supervisor Solis talks in terms of equity. We don't want to just talk about terms of equity, nor does she. We want to deliver on that substantively. And that guidelines working group is working on the prioritization, not just of populations, but subpopulations, to make sure we do justice to those values and those principles. We have a community advisory committee, 70 members, to make sure that those guidelines are real and that we deliver. And I encourage folks that are curious about the next iteration of vaccines, meaning the next available group of individuals, to learn about that by going to the covid19.ca.gov website, covid19.ca.gov website. This community advisory process is transparent and it's public. Those guidelines are available on the website, and you will determine exactly where you are in the queue. And I encourage folks to actively engage and utilize that website as a point of contact as we move forward through this next phase and through these next very, very challenging months. I want to thank Dr. Galley, who's here, very familiar, all of you down here in LA County. Comes with his own support network. But Dr. Galley has just been an extraordinary champion on the front lines, trying to work collaboratively with not only the counties and our cities, but within our healthcare delivery system. He is also the one helping operationalize the 4 alternative care sites that we have now just put up in the last week in this state. We have an additional 9 sites that are either in warm status or we're prepared to put up in order to get through the peak of these challenges. Dr. Galley's responsible for getting over 3,000 temporary staff members through contract services, our health corps that he's working to get more staff to help support our efforts through this challenging and difficult time. He's just done a magnificent job. I want to thank Mayor Garcetti. You know, one of the great things, you know, people talk in terms of partnerships. There's been no daylight. His demonstrable talents have been at display here in Los Angeles in partnership with the county and Hilda Solis. There's no sparring, there's no disagreements. There's just folks working hard every single day, working and rowing in the same direction. And so I would be, remiss if I didn't acknowledge that, because I can assure you that's not the case in every single state. Not every mayor, not every county board of supervisors, they're not all aligned with their state officials, I assure you. And so I just want to thank and acknowledge Mayor Garcetti for all his hard work and his counsel and advice, not just his work, but his leadership that that's not always demonstrable, because it's in those quiet moments where he's making calls and encouraging us in areas where we're not seeing things like he's seen them at the local level. County and the city, remarkable partners. So look, I'm down here in the spirit that is this moment, enthusiastic that there is light at the end of the tunnel, but mindful that we're still in the tunnel and that we need to do everything we've done to date, which is we have outperformed a lot of expectations because many of you individually have done the hard work of putting on those masks, the stubborn day-to-day work of keeping your distance from others. Let's not run the 90-yard dash. Next month and a half will be challenging. If we get through that, there is light at the end of the tunnel, as I said, but there will be resiliency and renewal, and it will be remarkable growth for this state, and we know our nation. So thank you all again for being here, and thank you, Kim, for being one of those first 5 to take this vaccine. And to the other frontline healthcare workers, we thank you as well for putting yourselves up, taking this vaccine, and doing so proudly and responsibly at this critical juncture in this pandemic. And with that, we're of course here to answer any questions. But first, I just want to highlight this new Vaccinate All campaign we just launched today. You'll be seeing a lot about on this. $32 million. We'll be funding a program focusing on equity, focusing on trusted messengers, focusing on communities that have been underserved, focusing on communities that have been under-resourced. This Vaccinate All campaign is about vaccinating all Californians, not just some Californians, not just connected Californians, but making sure we really do justice and reach out to communities that need to hear from trusted messengers, need to hear from community members that speak languages that people can respond to, not just language that we're using here and in Sacramento. So I hope folks will take a look at that site and encourage folks to learn more about that program by going to the covid19.ca.gov website as well. Happy to now take any questions, and of course anyone behind us as well. So I encourage you to go to the covid19.ca.gov website. You'll see the details. You'll see the plan that we put up. What we have on that site is Plan 1A, which is the distribution of the first 327,000 doses of vaccine. We're working on Plan 1B. Plan 1A has 3 tiers, subpopulations that in detail answer the question being posed. The Guidelines Working Group is working on Plan 1B with a focus on equity, with a focus on the challenging issues around distribution, particularly for the ultra-low cold storage issues related to Pfizer and the distinctions in the Moderna vaccine and its distribution. Those groups have been meeting since October 19th, when we conceived of the Scientific Safety Review Committee and put these subsequent committees together. So very comprehensive process, very independent protocols, very transparent as well. Information on that first phase on the website, and the subsequent phase will be made available right after our Community Advisory Committee signs off.
Next question from Claudia Casciuto of KNX Radio. Will the state plan to amend its coronavirus reopening system as vaccines become more widely available?
Yeah, we are iterative. We're not ideological, but for the moment, the baseline concerns remain that we're seeing substantial increase in community spread. We're seeing significant increases in total number of positive cases, and more importantly, perhaps the positivity rate spiking all across the state of California and every part of this state. For the time being, the new protocols we just put out, the regional stay-at-home advisories we put out, new protocols on enforcement from Cal OSHA and others will be effective. And as we move forward over the course of the next few weeks and months, we'll adapt based upon how this virus is adapting, based upon the data and the facts on the ground.
Jennifer Watts from ABC Network News asks, where do teachers fall in line to receiving the vaccine? We've seen other states say teachers will be a priority. What is California's plan to get teachers?
Teachers are a priority. Teachers are being discussed in our Plan 1B. I encourage folks that want to learn more. Their next public meeting is in a few days. We'll be discussing our food supply system. That goes to farm workers. That goes to the frontline workers out there at the grocery stores. It goes to the critical and essential nature of our public educators across the spectrum, paraprofessionals, not just teachers themselves, and other essential workers. So that's part of Plan 1B, and that's our Guidelines Working Group working on that with our community advisors, and that information should be made public formally, meaning we'll sign off on the recommendations of those 2 bodies in the next few weeks, but those deliberations are public and transparent, and I encourage people to learn more by going to that website.
Alex Michelson from Fox
Well, we had 11 world-class experts, some of the finest scientists and doctors, 3 of which are working as advisors to the FDA and CDC. 1 that was actually picked by the Biden administration, Vice President, or now President-elect Biden, to join his COVID advisory committee. The best of the best independently review, put their reputations on the line, look at the veracity of all the claims coming from the federal government, and independently certified unanimously of the efficacy and safety of this drug. They were joined by 6 additional leaders from 3 other states that did the same. We have all the confidence in the efficacy and safety of these vaccines. And while there's side effects to any vaccine, you can talk to Kim perhaps about that in more detail, having just taken the first dose of the vaccine a few minutes ago. We are very, very confident, not only its efficacy, but its safety.
Next question comes from Terry Garza of Orange County Register. Will you, Governor Newsom, be getting the vaccine? And if so, when?
I will, whenever it's available to someone in my position, meaning I'm not cutting the line, not getting in the line. I have no problem taking the vaccine. I look forward to taking this vaccine. I'm confident in its safety and of its efficacy, but I'm not going to get in the way of any of the critical workers I see in front of me and the folks behind me that are more deserving, and tell that it's the case to all of those that are in need, get it, the most vulnerable, then I will not get in the way of that.
Christine Laser from CBS 2 asks, who is paying for this, from transportation security to treatment, vaccine, and storage? Is the federal government paying for any?
Yeah.
Do we know what the cost is?
All of us as taxpayers, federal taxpayers, are paying for this. There's no cost of the actual vaccine. What may occur is there will be administrative costs, and those costs will be borne to the extent that they are extended in clinics or other settings, in pharmacies or hospital settings. The state of California will absorb those costs, so there's no cost to getting the vaccine for people on Medi-Cal. There'll be no costs for people getting the vaccine that are otherwise insured. There should be no cost associated, but there may be costs borne by those in the entire healthcare delivery system, but not the person that is actually receiving the vaccine.
There's federal money on the table today with the
Yeah.
congressional stuff. We're paying for this.
Yeah, no, which is great too. So, and then of course the federal government in terms of the back end logistics, the IT issues, the marketing issues, the broader issues of distribution, federal government is going to be critical in terms of providing support for the states and counties and local health officers all up and down, not only this state, but across the country, to absorb those costs associated, those indirect costs associated with the administration of the vaccine.
Pete Wolverine of Fox 11 KTTV asks, many people understandably are frustrated by the closures here in California. Can you speak about the viewpoints of
Well, the opportunity to end the closures presents itself anew today. As soon as we extinguish this virus, as soon as this virus is eliminated, as soon as this pandemic is behind us, this state will recover more resilient, more vibrant than ever. And so the most important thing we could do from an economic perspective is focus on public health, focus on mitigating the spread of this virus, eliminating this virus. And the most important thing, non-pharmaceutical intervention we can do is wearing face coverings. The most important pharmaceutical intervention is getting a vaccine when it's available, when your number proverbially is up. And so we're encouraging everyone to do that when it becomes available.
Kathleen Ronan of the Associated Press asks, do we have any evidence at this point that shutdowns, the latest shutdowns in California, are having the intended effect? Are you seeing people change their behavior in measurable ways?
Yeah, we're seeing that on movement data. We're privy to movement data, which is open source data that you get that is made public because of our utilization of our cell phones, smartphones, and the like. We are seeing a reduction from a rate of growth as it relates to that movement. So we are seeing impacts in that respect, meaning the likelihood of minimizing mixing is taking shape, obviously, by reducing the number of opportunities for contacts in some of these settings. We are obviously, by definition, seeing a reduction in that kind of mixing. So there is evidence in that respect, and that is buying us time and helping us, allow us to decompress our hospital system for non-essential or emergency services, and allowing us the ability to get the staffing, build out the facilities, and prepare for the next 30 to 60 days.
Nathan Solis, Courthouse News Service, asks, the state leased St. Vincent Medical Center back in March to help with influx of COVID-19 patients. The campus is currently being used for a film shoot. Why are film shoots still being allowed to operate in locations like this while hospitals prepare to start delivering?
I don't know the details of that particular location as it relates to the current use. We used St. Vincent during the first phase of this pandemic as an alternative care site. It was identified as an alternative care site. Fortunately, we didn't need to move beyond its warm status in the beginning of this pandemic. We have currently identified 11 sites that are in warm status up and down the state of California. That site is not one of those 11 for the purposes of our current planning, but we maintain vigilance as it relates to looking at alternative sites in addition to St. Vincent. We are looking at other sites here in Southern California.
Our last question is not about the vaccine, it is about an ethics policy concerning Sophia rollout in the Sacramento City. She asks, will your new ethics policy provide for basic opinion? Will you continue to seek his political advice even though he's registered as a lobbyist and how many outside political consultants does this policy currently apply to?
Yeah, we submitted that, I think, comparatively the highest standards that any previous administration has advanced. I encourage those that want to learn more about it to take a look at what we put out over the weekend, and I would encourage others to consider similar standards in terms of their work. As it relates to details of individuals and all of that, I'm happy to follow up and provide that for Sophia. All right. So with that, let me again thank everybody for their time and attention. Thank you for listening to all those Q&As as well. And thanks to all these folks. Thank you, Greg Adams. And again, thank you to Supervisor Solis and your outstanding mayor, Mayor Garcetti. Thank you all very much.